Hi, and welcome to the Ask Dr. Angela podcast with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been too embarrassed or shy to ask your own doctor about your, girl parts? Well, you've come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. Obstetrics and gynecology? She keeps it real. Pregnancy? She's been there, done that. Menopause? She'll get you through. Young or old, Dr. Angela's got you covered, girl. Now, here's Dr. Angela.
What's up, people? This is Dr. Angela, everyone's favorite OBGYN, and I would officially like to welcome you to episode 334 of the Ask Dr. Angela podcast. Today's topic of conversation is urinary incontinence, and I am just overwhelmed, completely blown away, and just amazed, grateful, all of these things to have Dr. Samantha Poyam as my guest today. And just, complete aside here, I have not seen my good friend Mandy in like over 20 years, like the beginning of residency maybe. And then, our paths kind of diverged, and she is back in full effect mode, completely blown up. I mean, just her accomplishments, just to run down a few of her credentials, which are like beyond impressive, and for this purpose, Mandy, I'm just going to call you Mandy.
Please do.
I'm
Please
completely
do.
casual, but for all of y'all out there, she is Dr. Poyam, Dr. Mandy Poyam. But Mandy, she was previously the division director for female pelvic medicine and reconstructive surgery at UNC Chapel Hill. She's been an associate director of female pelvic medicine and reconstructive surgery at Mass General in Boston. She's been past council chair for the American Urogynecologic Society, and she remains very active in their mentorship program. She received her Bachelor of Science degree in biology from Duke University. Go Duke, NCAA
Go Duke.
tournament. And her medical degree from Wake Forest University School of Medicine. She completed her residency at Brigham and Women's Hospital, did her fellowship training at Mount Auburn in Boston. She is, of course, a board certified obstetrician gynecologist, and she is also board certified in FPMRS, which is female pelvic medicine and reconstructive surgery. Currently, my good friend Mandy is the chief medical officer for Renovia, which is a women-led company, which, of course, raised my eyebrows. I love to see women creating, leading, and just succeeding. Renovia is a company that develops digital therapeutics for female pelvic floor disorders. And so, Mandy, welcome to my podcast. Thank you so much for being here. It is an absolute pleasure to have you on the podcast.
It's my pleasure to be here. It's great to see you again, Angela, and I'm looking forward to our conversation.
So let's just jump right into it. Urinary incontinence. It's like one of those things that is so much more common than people realize. I think I read, 78 million women affected by this. Why do you feel like we don't hear more about this? I mean, that's a pretty staggering number.
Yeah, it really is a staggering number. When you think about it, it really is the level of a public health crisis, and why we're not hearing about it when we hear about so many other health problems. It's really confounding. But I think there are a couple of reasons why we don't hear about it. One is that women in particular don't talk about it. It's embarrassing. You might joke about it with your friends, but it's hard to bring up to your doctor. And then the other half of that is that doctors don't really talk about it either. So we're all caught with a lot of silence and a lot of underlying beliefs, things like, oh, this is just part of being a woman, or, oh, this is just some of the burden of having children. And perhaps generationally, we don't talk about it with our mothers or our grandmothers. And so it's hard to think about what might be done about it when it's considered such a common part of so many women's lives.
I couldn't agree more. It's like one of those things, and, since we're, gynecologists, I'm just going to say it. It's like vaginal discharge. Everybody has it, but nobody's saying anything about it. And, I do feel like women, get embarrassed, to bring it up. But again, having these kinds of conversations lets folks know that it's a lot more prevalent than you think. And I always tell people, I promise you, you are not the only one, and certainly, that old school thought of, it's just part of being a woman, you know,
So damaging. It
exactly.
really
I mean, is
is.
this
It
happening
really
to men?
is.
They don't say that's just part of being a man.
And they never would. I think
Exactly.
I think we
Exactly. So
silence ourselves. Yeah.
for listeners that don't even know what incontinence is, I'm going to leave it to you just to give us like a very simple definition. What do we mean when we say incontinence?
Sure. So urinary incontinence is about leaking urine or leaking it when you don't intend to, right? So if you're in the bathroom and you need to urinate and you sit down on the potty and you go, that's not leaking. But if you're out running and you feel leaking coming every time your foot hits the ground, or if you're rushing to the bathroom and you can't get there in time and you leak before you get your pants down, that's urinary incontinence. There
Yeah,
are a
so
couple of
it's like
different
one of those
kinds.
things where you might leak a little bit or you might leak a whole lot.
Right, right. They're both incontinence. And so sometimes I think women say to themselves, oh, I don't really have this because it's not so bad. I just wear a little liner. But if you leak when you're doing those things, then you have urinary incontinence. And if you're willing to wear a liner, it probably means it bothers you to some degree, right? I mean, it's
Right,
something
right,
about your
right.
personal hygiene that you have to attend to, and that makes it important.
So let me ask you this. Aside from, leaking urine, what are some other common symptoms that people that have urinary incontinence might
Right.
experience?
Right. So there are a couple of different kinds of urinary incontinence, and it's worth mentioning at least the two most common because the treatments of them can differ as you go through the
Hmm.
process. There's stress incontinence, which is leaking with coughing, sneezing, running, jumping, exercise. So essentially, anytime you tighten up your belly, your abdomen, that pushes down on your bladder. So if you imagine a sneeze,
Hmm.
that pushes down on your bladder, and the muscles in the pelvis aren't strong enough to hold the urine in when you sneeze or cough or laugh or jump or run, and out squirts a little bit of urine. So that's one kind, stress incontinence. The other kind that's common is called urgency incontinence. And that's urinary leakage that comes along with a sense that you have to really urinate very badly, so much so that you can't control it, even if the bathroom's very nearby. So a lot of people have this experience with running water, maybe when they're thinking of getting
Hmm.
into the shower, washing dishes, or a lot of women have this experience when they see or think about a bathroom. So a common time that someone might experience this is if they're just getting home and they know exactly where the bathroom is, they could throw off their clothes down the hall if they wanted to, but instead they still can't get there in time.
Right.
And that can be a very sort of dramatic and troubling problem, especially if you're in a public setting.
Sure.
So those are two kinds, and then there's sort of a third kind, which is just an overlap of the two. That's called
Hmm.
mixed incontinence when you have both symptoms.
So, Mandy, let me ask you this. And what are the most common causes of urinary incontinence? Like how does this happen to us?
Right. So that's a great question. And I think you can probably blame your children on some level for urinary incontinence. Pregnancy itself
For sure.
and vaginal deliveries, especially, can contribute to urinary incontinence. But just being pregnant can also contribute to urinary incontinence. And then deliveries that may need some assistance, either like by a vacuum or a forceps
Hmm.
delivery, can also contribute to that. It gets complicated because you don't want to discourage people from having those sorts of deliveries if necessary. I mean, clearly, when you're giving birth, you care about the life of the child you're giving birth to, and you
Sure.
want that to be safe. But sometimes those things actually can have a larger impact on continence down the road.
Sure.
So that's a big one. Some other things that may contribute to urinary incontinence include being overweight.
Hmm.
Um, and then also, although aging doesn't cause urinary incontinence, I think women do begin to see incontinence more as they age. And we're not quite sure what aging has to do with it, but I think like other parts of getting older, you lose a little muscle mass. Maybe the muscles in the pelvis aren't working as well as they have been because you're not as strong as you used to be, just
Hmm.
because time goes by. Menopause also can contribute to that a little bit in terms of losing muscle function and muscle strength over time.
I'm really happy that you mentioned menopause. I'm curious to know how significant do you think menopause is actually with regards to causing incontinence?
So I think a lot of women who maybe have been coping with lower levels of urinary incontinence, perhaps since the birth of their children in their 20s or 30s, begin to see sort of a worsening of incontinence when they develop menopause, maybe in their late 40s or early 50s. What happens there is that as the ovaries stop producing estrogen, the major hormone that they produce, estrogen has a big impact on the bladder, which holds the urine, and the urethra, which is the tube where the urine comes out. And both of those get a little bit thinner. The tube where the urine comes out is usually sort of closed upon itself so that it forms a plug. And as that gets thinner, it's a lot easier for urine to leak out. So menopause actually has some direct cause of urinary incontinence, which I think is why so many women, maybe who've been coping with urinary incontinence in the past, suddenly realize this has become such a big problem, I can't cope with it anymore. And by the way, just because you can cope with urinary incontinence doesn't mean there's nothing more to do about it. A lot of women put up with stuff and then suddenly they can't put up with it anymore. And it may be that beginning to work on something like urinary incontinence before it becomes something you just can't tolerate would be helpful.
So I'm gonna probe a little bit more
Okay.
on that topic with regards to menopause. You talked about the decreased estrogen levels. Do you recommend, I know that, we use vaginal estrogen to treat atrophy. What impact would that have on continence? How significant of an impact, if any, would that have?
Yeah. So it may have some positive impact on incontinence. In my practice, I don't usually recommend it as the only treatment for urinary incontinence, but I think it's sort of a helpful also. And it works actually by improving the blood supply to the urethra, the tube where the urine comes out. So it's easier to keep it closed. And it may also help to contribute to muscle health sort of more broadly.
Gotcha. And you mentioned, I always tell my patients I'm a huge lifestyle, advocate, with regards to eating well, staying active, et cetera. And you mentioned weight. I'm curious, how much weight gain do you think, or weight loss, I should say, do you think folks would have to have in order to notice any kind of significant improvement in their urinary incontinence?
Right. So it's an important question. And I think one of the things to remember is that how much weight loss you need to have depends on how much overweight you are in the first place. But there are some studies that show that weight loss at the level about 8%, 7 or 8% of your body weight is enough to begin to improve your urinary incontinence symptoms. Now, this is sometimes challenging because it's sort of a catch-22. If you decide to exercise to help lose weight, you may leak while you're exercising, and you may not want to leak while you're exercising. You may wish you didn't leak so that you can exercise. And this is a challenge, I think, for women who need to lose weight, which will no doubt help their incontinence. They may actually put up with leaking while they're exercising to begin with.
Right.
Very challenging.
Right. So let me ask you this. So, as a generalist, I see a little bit of everything. And, certainly after I've done, maybe some recommendations with regards to weight loss, fluid restrictions, maybe, before bedtime, maybe even, just some kind of lifestyle modification. And if that isn't working, of course, I'm like, well, I'm going to send you to see my good friends, the urogynecologist. And so I think what a lot of folks would like to know is once they come and see a specialist like you, how do you diagnose their urinary incontinence? What does that workup look like?
So, I think, a couple of things that are important to say. First of all, urinary incontinence, the symptom of urinary incontinence is really defined by bother. So if you came to me and you said, every time I go running, I leak urine, I need to wear a pad, I would say you have urinary incontinence. The diagnosis itself really is in the information the woman provides at the beginning. Any form of unintentional leaking is urinary incontinence. And it may be that my first task, if I'm interviewing a woman who has come to see me because of incontinence, isn't so much understanding that she has it, but it's more about understanding what the sort of sub-diagnosis is. Is it stress incontinence when she runs and jumps, or is it urgency incontinence, she can't reach the bathroom, or is it a combination of the two, or is it something that's a little bit more rare problem like overflow incontinence or functional incontinence? If you're not able to move yourself to the bathroom fast enough, there's nothing wrong with your bladder, there might be something wrong with your legs.
Right.
So figuring out what type it is can help with treatment. Although for the three major types of urinary incontinence, stress incontinence, urgency incontinence, or a mix of both, the first treatment is always the same. You've mentioned some of them, the behavioral treatments. That might be things like drinking a regular amount of water without such big peaks, right? You don't want to
Right,
20-ounce big gulp followed by 3 hours of not drinking. You want to drink regular amounts. And you want to avoid things that irritate the bladder, like coffee or caffeinated beverages, a lot of them. I would never tell anyone to stop drinking coffee entirely. But then also important for all three of those major types of urinary incontinence is pelvic floor muscle strengthening. Sometimes that gets called kegel exercises, although I think there's a little more to it than that. But that's really the beginning and the basis for all treatments, is just to strengthen the muscles that help the bladder work.
Okay, so let me ask you this. I'm so happy that you mentioned Kegel exercises, because it's like the one thing that I feel like nobody really understands how to do. First of all, can you please just explain to us what is a Kegel exercise, and how would you best explain how to do them, how often people should be doing them, how long it takes, to perhaps see some benefit, etc.
Right. So a Kegel exercise is squeezing the pelvic floor muscles. And that looks like a lift, meaning well, let's back up a minute. The pelvic floor, if you put your hands on your hips, everybody's got hips, I think, the muscles that are a basket inside the bony part of your pelvis, and all the opening, those are the pelvic floor muscles, and all of the sort of the openings in the pelvis come through them. So the tube where the urine comes out, the urethra, the vagina, and the rectum and the anus, all of those openings come out the pelvic floor. And so the pelvic floor squeezing and relaxing is really responsible for allowing things to come out, like urine or stool, and also holding things in, again, like urine or stool. And then in women, those muscles have many other sort of challenges and also opportunities, whether we're talking about an orgasm in which they contract, or whether you're talking about having a baby in which you're pushing a baby's head through them, which explains a little bit of why a delivery actually has some damage to the pelvic floor. You can just imagine, the baby's head is much larger than they are usually. So that's where the muscles are, and squeezing them is lifting up or in, sort of like thinking about not passing gas, that sort of a squeeze, lifting up and in towards the belly button. So in the end, the pelvic floor muscles lift up, and they also lift sort of forward towards the pubic bone, which is that bone right in the front, and they compress all of the openings, right? So if you want to hold urine, those muscles contract, and that compresses the urethra against the back of the pubic bone, and that closes it off and keeps urine in. So strengthening that process can help hold urine when you cough and sneeze. It can also communicate to your bladder, we're not going right now, which is what happens when you have urgency incontinence. You feel an urge, those muscles squeeze, and they essentially say to your bladder, not right now. We're not going right now. So that's how those things work, and that's what a pelvic floor muscle squeeze or lift is, a Kegel is. The challenge is, unlike your biceps, I can hold up my muscle here and we can tell if I'm exercising it properly, right? But I can't do that for my pelvic floor, no matter what show I'm on. No one can see the pelvic floor, right? You can't see it. And so exercising it can be a challenge, right? If everyone listening right now does a squeeze of their pelvic floor, the next question is, how many people know if they're doing it right?
Yes, thank you.
Right? Nobody knows. You can't see them, right? How do you know if you're doing it right?
I know it's not like we're going around flexing our pelvises, right?
Right. And even if you did, nobody would know, right? So it's a challenge, right? To exercise those muscles properly. So in some ways we're in sort of a conundrum, right? We know that exercising those muscles can help with urinary incontinence. We also know it's hard to do those exercises. It's hard to know if you're doing them properly. And so, what should you do? How can you know you're doing those exercises properly if you can't see or, get that kind of feedback? So that's a challenge with the exercises. And I think it's a challenge for a lot of doctors who recommend those exercises. I traditionally have given patients a sheet of paper and said, here's how to do these exercises, go home and do them. But after a while, I felt a little silly, right? Why am I giving you these exercises? Even if you follow the directions, I still don't think I or the patient, the woman I would be giving those to, could understand whether they're doing them.
For sure.
I don't think that means it's hopeless, but I think it does mean that women generally need a little bit of guidance in terms of how to use those muscles.
Right. So
So
that is a great segue into what you are currently doing at this moment.
yeah,
The leva, system. Congratulations on your recent publication in the Green Journal.
thank you.
That's amazing. I would love for you to talk to us a little bit about the study and then elaborate on just is it the leva system?
It's the leva system. Yeah,
Okay.
the leva system. Um, So the Leva pelvic health system. So thank you for the opportunity to talk about it. And I want to say just from the beginning, well, two things. One is that Renovia, the company that I work for, is the sponsor of the study. But the people who accomplished it are researchers from academic medical centers across the country, and we're really indebted to them for the high bar that they set
Sure.
in terms of research and practice, and also for the excellent work they did in accomplishing the study. I took this job out of clinical medicine, caring for patients, because I saw the Leva pelvic health system as an opportunity to really care for a lot of women, right? To reach a lot of women who might not otherwise get care. So one of my commitments when I took this job was that I wanted to provide evidence that this device that we have, the system that we have, actually works. Because too often I think women have been given things that seem cool or seem
Sure.
interesting, but there's not a lot of data behind them. So that's really one of the reasons I'm proud of this study, because I think it was a very well done study and a really convincing study in terms of
Sure.
the sort of research methods and all that sort of stuff. So let me try to tell you about it. What we did was, first of all, we did this study all remotely, all virtually during COVID. That meant
Sure.
that women didn't have to come into a medical center or into a doctor's office to begin participating in the study. They could do it after clicking on an ad through the internet to participate. And what that meant was that during COVID, we did research and safely for everyone. So we asked women to fill out a questionnaire about whether they had urinary incontinence, how long they'd had it, and so forth. And if they met the entry criteria, which was essentially if they had experienced bothersome urinary incontinence for 3 months or more, then we allowed them to join the study. And they were randomized, meaning we basically picked out of a hat whether they got assigned to one group, which was people doing kegel exercises like we've just discussed, getting a
Sure.
sheet of paper with instructions at home alone. For the other group, we randomized them to receiving the leva device and also downloading the app and doing exercises using feedback from the app. The leva device is a wand that you place in the vagina to do exercises for 2.5 minutes twice a day.
Okay.
So that's the recommended use. So in this study, we randomized people to one or the other. Actually, in the study, we asked people to do both sets of exercises 3 times a day because we wanted to ensure that people did them twice a day, which is exactly what happened. And then we had them collect some information for us for us at the beginning of the study and at the end of the study. The information we collected was something called a bladder diary, which is sort of a pain in the neck and not something necessarily that you need to do for yourself unless you're participating in research.
Sure.
But we asked women to report for 3 days at the beginning of the study, and then 3 days after 8 weeks of exercise, how many leakage episodes they had.
Right.
Also, we asked women to fill out a survey. The survey, for anyone who's interested, is called the Urogenital Distress Inventory. It's basically a series of 6 questions that sort of dig into how bothersome and how severe is your urinary incontinence. So we asked those questions at the beginning of the study, at the end of the study, and then we compared the 2 groups, the Kegel exercises and using leva. And the outcomes we were looking for were, did one group or the other have a superior improvement of
Sure.
symptoms, right? And the other is, did one group or the other have more or less leakage episodes by the end of the study? What we
Okay.
found was that people who used the leva device had better outcomes, both in terms of the survey results that showed the severity of their urinary incontinence, how much it bothered them,
Right.
and also in terms of a count of how many times they had leaking over 3 days.
Right.
So those are the so-called primary outcomes of the study, the survey results and the urinary incontinence number of episodes. But they come together to show that women who use this device have better, more effective, really, pelvic floor muscle exercises and a superior improvement in symptoms. So
Okay.
I think this really solves one of the problems that we've just been talking about, which is you can't see your pelvic floor muscles. Using this leva wand actually helps women see what they're doing and understand if they're doing the lifting properly. That's the kind of feedback we get. And it's based on motion. So if you move your pelvic floor muscles, the little wand moves on the screen of your smartphone, communicating with the wand that you've placed in the vagina. And the whole exercise series takes about 2.5 minutes, done twice a day.
So let me just, for point of clarification. So
Sure.
with the leva system, you put the wand in your vagina, and then, or what are we doing? Just
right. So you put the wand in the vagina. The wand has wireless communication via Bluetooth to your phone.
okay.
Okay. And on your phone, you see motion. So the wand contains accelerometers. You know those things that change the picture on your smartphone when you rotate it?
Yes.
Changes it from portrait to landscape. So those things basically are positional locators. We have a bunch of those in this wand, and it basically shows the position of the vagina when you place the wand in the vagina. And then as you lift the pelvic floor muscles, it shows the motion that you make the vagina, how you make the vagina move when you lift the muscles. And it also shows inappropriate movements, right? So surprisingly, one thing that happens when women lift their pelvic floor muscles or think they are is that they're actually bearing down, which is sort of the opposite of what you want to do. So this device will actually show women if they're doing the exercises improperly and help them to learn to do them properly.
So that's great feedback, because this is a sure way to know that you're doing the exercises correctly, which will lead to, improved outcomes, and you won't feel like you're wasting your time.
Right.
So, sometimes we need that visual aid to say, hey, you're doing this the right way, because if you don't know, then you just might be kind of like, whatever, wasting my time.
The other thing we found in the study was that after about 4 weeks, women began to see results. Now, the challenge in doing exercises, and this is true whether you're doing pelvic floor muscle exercises or whether you're going to the gym, is that you do your exercises for a week or so and you think, nothing's happening, right? And that's true. I think we maybe humanly expect results almost immediately, but 4 weeks is actually very quick, very soon. To see results compared to traditional pelvic floor muscle exercise regimens, which usually take about 12 weeks really to see results. If I were advising someone in my office, how long do you think you need to participate in Kegel exercises? I would probably tell them 3 months is a really good time frame. The good news is, though, that doing these exercises regularly for 4 weeks using leva will actually result in improved symptoms.
Nice.
Yeah.
So let me ask you this. Who were good candidates for the leva system?
Right. So pelvic floor muscle training, and leva assists with pelvic floor muscle training, is first line care, meaning the first thing women should try if they have stress incontinence, leaking with coughing and sneezing, urgency incontinence, and mixed incontinence. And I guess the good news here is that leva is indicated for all three. It's indicated for stress incontinence, it's indicated for mixed incontinence, and it's indicated for mild to moderate urgency incontinence. In addition to just pelvic floor muscle strengthening, really even in the absence of urinary incontinence. One thing that's true about leva that I ought to mention is that it's a prescription product. So you need to go to see your OBGYN. You don't even need to see a specialist for this. I think it's great for physicians such as OBGYNs or even primary care doctors to begin this process. And then the doctor actually gets a report every month about a woman's progress, about how well she's doing in terms of keeping up with the treatment regimen, and also how she's doing in terms of the sorts of surveys that might show improvement in symptoms.
Cost-wise, how expensive is the leva system?
Right. So the leva system is a list price of $950, and we are working for insurance coverage. For women who choose to purchase the device themselves, it's about $650, and we have payment plans that are interest-free.
Nice.
So we think it's affordable over time, and certainly the benefits of it are such that if you can avoid a surgery or some other sort of larger intervention, it will be savings.
Exactly. That was one of the things that I was going to mention. This is a really nice alternative to, the annoyance sometimes of having to take a daily medication a couple times a day, or even having to undergo surgery. I mean, and it sounds like your results pretty
Right.
promising. I mean, certainly one of the reasons that I was so excited to have you on is I'm always looking to, give women information so that they can have all of the options
Right.
and make, the most informed decision with regards to how to treat things. I mean, Mandy, honestly, this sounds amazing. Let me ask you this. Are there any contraindications to using this system?
So there aren't so many contraindications per se. There are some situations in which you ought to consult your physician or healthcare
Sure.
provider. For example, if you find that you become pregnant while you're using leva, you ought to talk with your doctor about that before continuing.
Okay.
So other than that, leva shouldn't be shared. It's a one user device, and I think that maybe
I
goes
was going
without
to ask
saying.
you that.
And other than that, there really is no risk or danger. It's a very the product itself is not very large. In other words, to place
Okay.
it in the vagina, it's about the size of a small tampon,
Okay.
and so it's not something that women need to worry about in terms of painful placement or discomfort, and also
Okay.
doesn't have to stay in very long, and
Okay.
shouldn't, and it should be washed in between uses.
I was just going to ask you about maintenance of the Leva.
Yeah,
Is it something, does it have to charge? Does it have a base?
right. So it comes with I'll say I think it's a pretty discreet looking case. You could put it in your purse or your travel bag and nobody would know what it was.
Oh,
Um,
nice.
the case has a battery in itself, and it's actually part of the process. The leva device
Mm-hmm.
wirelessly communicates with the case, which communicates with your phone. So the
Mm-hmm.
case is sort of an integral part of the device itself.
Sure.
But it's really a very nice system, and I think for most women that I've interacted with who've used it, they find it very non-intimidating because
Sure.
it's not a very big device.
That's
So.
that's fantastic. So, Mandy, if people want to learn more about this system,
Mhm.
how can they do that?
So we have a website, levatherapy.com,
Okay.
and that's probably the best place to start. And I think what's on that website will be information about the app and about the wand, and also some ways that you can speak to your healthcare provider about leva.
Okay. All right. I,
And
I
I
think that's
think,
amazing. I actually, during my stint on call last night, I told some of the residents that I was, doing this podcast with you. And they, of course, were so excited because they're like, oh my gosh, yeah, that's like the latest rage and, for addressing urinary incontinence. And I'm just really happy to have this platform to be able to talk about, issues in women's health, that aren't taboo. It's just a part of life. And
right,
certainly, having you on as a guest is just more, it provides more support that you don't have to just exist with these things. It's not a normal part of being a woman. And as you said, it's not an issue unless it's interfering with your quality of life, which is
right,
always kind of my go-to for when I'm taking people to the operating room.
right,
If you're good, I'm fine. But when it starts interfering with your ability to function and do your normal chores, hang out with your friends, etc., then I think that it's time for some sort of intervention. And certainly, I always think less is more. This is minimally invasive. It doesn't involve a trip to the OR. And with regards to price, you know, invest in yourself. I always tell people, you are worth it. Treat yourself, you know?
yeah.
So just
And,
in closing, Mandy, is there anything else you'd like to say before I wrap this up?
right. So, I mean, even just what your comments there, Angela, I think, women are always at the bottom of their own list. They take care of their
Yes,
families, their children, their parents, their spouse. And I think it's important to understand, this is a problem that affects women in their younger lives. It
for
also
sure.
affects them as they age. And I think that putting off treatment, may not be your best choice. I think,
Right.
better to take care of things now, maybe when
Yes.
they are early on in the process than much more down the road when I think things may be a little more challenging. I want to mention just one more thing, if you don't mind, which is
Of
that
course.
a lot of times doctors hesitate, and I think patients may hesitate too, to give sort of new technology to people who are a little older. I think if anything that the pandemic has taught us is that we all know how to Zoom, right? We all know how to FaceTime
for sure,
no matter what our age is. And so I think the technology piece really is not only is it a mistake, I think, not to offer this to your older patients. I think it's a real opportunity for them. And in fact, we find that women in the older age group are just as able to participate in using leva as younger women. So I think in that sense, there's a real opportunity here for a whole span of women, and you don't even have to go into your healthcare provider for continued care while you're using it. You do your exercises at home, which is wonderful.
Exactly. That's actually a really good point, Mandy. I think a lot of times providers forget about, the elder patients, so to speak. And the fact of the matter is people are living longer. And, my 65 and older population, they are living. People are having sex more often, more frequent, dating a ton of folks. Folks are really living. So, I think that this is an option that you should present to everyone.
Great. Yeah, I think so. 65 gets closer and closer for me. I realize how young it is.
Same. Look, same. We're not even going to go. We're not even going to talk about.
No, we don't have to go there. We've known each other too long to talk about age.
We're going to leave that one alone. But what I would like to say in closing is thank you so much, friend, for coming on my podcast. I think this has been amazing. It's been a wealth of information, and I'm really excited to have been able to talk about this brand new system. I think that a lot of people will listen to this. A lot of people will look into this. And frankly, it's something that I will now offer to my patients. It's nice to know that there is this option instead of just, sending everyone to see urogyn. This is a step that generalists can take, initially, prior to making that next move. You're amazing. I just want you to continue to, succeed and win and share. I am happy to call you friend as well as colleague. So in closing, thank you so much, everyone, for tuning into this episode of the Ask Dr. Angela podcast. You know where to find me, www.askdrangela.com. That's AskDrangela.com. There you will find all of me, i.e. my blog posts, my podcast, my social media channels, etc. In closing, I'm going to leave you with a quote from one of my favorite authors. And this comes from a book that I've had since I was in high school. She Went Out on a Limb by Sandy Gingras. And this quote is from Ralph Waldo Emerson. Remember, every wall is a door. Okay? Every wall is a door. So until next time, stay well, stay happy, be safe. I cannot wait to speak with you on the next podcast episode, which is episode 335. But until then, remember to choose happiness. Take care.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon. All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any disease or illness and does not and should not replace treatment from a medical professional. Listening to and participating in this podcast does not create a doctor-patient relationship between you and Dr. Angela Jones. If you need medical advice or assistance, you should consult a physician. Listening to and participating in this podcast is subject to the terms and conditions posted at askdrangela.com/terms.